Hi, my name is Leanna Kaiser, a student physical therapist. Today what we're going to be working on is doing a stretch of your Teres major and Latissimus dorsi muscles, which are right back here. They help with bringing your arm back, so we're trying to stretch them so that you have more flexion of your arm, which is bringing your arm forward like this. So first off, are you okay with being in this recording?
I am.
Okay, and is it okay that my teacher and other classmates may view this recording?
Absolutely.
Okay, great. So the purpose of a stretching technique is to help with that motion, as I was explaining. For this purpose, it's helping with the bringing your arm in that movement upwards more. So it helps with limiting restriction of movement within that joint area for wherever you're stretching. So for this case, the shoulder. And then it also this increase in movement can help with limiting any functional limitations that you may have. So say you are maybe reaching and you're having trouble reaching up to put away your dishes or something, and that would be a functional limitation. So this would help aid in something like that. In addition to that, it can also help with any pain that you might be having in that joint, because it'll increase blood flow to that area, and the increase in blood flow will bring nutrients, and also it increases the amount of that synovial fluid that's lubricating that joint. Okay? Do you have any questions so far?
No, fine.
Okay. So another thing that I wanted to mention is throughout this, at any point, if you feel pain or discomfort, you'll stop the test, you'll let me know, and then we'll reevaluate and try to perform it again.
Okay.
So another piece of information that's important to know about stretching is it is recommended to do 30 to 90 seconds of stretching. There is something called a stress-strain curve, in which scientists have figured out how we should be stretching a tissue in order for it to create more elongation and get results that you want, but also not exceeding a point to where we're passing what's called a yield point, in which you would make that tissue elongate past its point of being able to return back to its normal length. Okay, so we don't want to go way too past that, so we keep this 30 to 90 seconds as our baseline. And this can be broken up because 30 to 90 seconds can be a very long time for someone to stretch for when they're first starting out stretching. So we can do, you could do 2 sets of 30 seconds, or we can go even as low as 2 sets of 15 seconds and then work our way up. And then eventually you can increase that amount of time to 2 sets of 60 seconds to help with keeping that. And then also we would definitely want to try and do these stretches 2 to 3 times a day to enhance that flexibility of those tissues, okay?
Okay.
Alrighty. Just making sure I'm not missing anything. Okay, and you want to stretch to a point that you're having mild discomfort, but you do not want to feel pain. So again, if you're feeling pain, we want to come off of that stretch. And if you're still feeling pain, even coming off that stretch, we'll reevaluate, okay?
Okay.
Alrighty, so another thing is just make sure you're breathing throughout your stretch. Don't hold your breath, because that can cause other issues and make you tense up more. So breathing helps you with relaxing more. Alrighty, so now that we're done with that, I'm going to show you what I want you to do. And then once we're done with that, we'll go ahead and have you do it, and we'll hold that I'm going to go with, because I know you do a little bit of stretching, but you're still somewhat new to it. So I'm going to go ahead and do 2 sets of 30 seconds, and then we will progress it with the next session.
Okay.
Alrighty, so what we're going to do, and I'll give you this once we get started so you have an easier time, but we're going to have your arm out, and you're going to have your elbow slightly bent, and then you're just going to go forward and hinging at the hips until your head hits about the point of where your shoulder is, and then you're going to feel that stretch right in these muscles right here. Okay? And then we're going to hold that for 30 seconds. Alrighty? Okay, so we'll go ahead and have that, and then slight bend. Perfect. Alrighty, and so we'll just bend at the hips. How's that feeling?
Good.
Okay. Do you feel the stretch and with mild discomfort but not pain?
Correct.
Great. Okay, so and 30. So we'll go ahead and come off of that and we'll rest for a few seconds. Actually, what I'm gonna do is we're gonna switch places so we can do the other side while we're letting that other side rest for a bit. Okay, so same thing, that's outside bent elbow, perfect. And then we're gonna just hinge at the hips. Okay. Just wanna make sure you're feeling it right in here, correct?
Mm-hmm.
Okay, perfect. And 30. Great job. We'll go ahead and switch places again if you feel comfortable doing that. If you need a break at any time throughout this, just let me know as well. Okay?
Mm-hmm.
And whenever you're ready. Great. Good job. And you're doing a great job breathing.
It's something I do naturally.
Alrighty, and you can extend or bring your elbow a little straighter. Alrighty, okay, perfect. Now go ahead.